Hey there, welcome back to my channel. Today, we're going to talk about a serious topic, acute myocardial infarction, commonly known as a heart attack. If you or someone you know has ever had a heart attack, you know how scary it can be. But understanding what's happening during a heart attack can help you make better decisions and potentially save a life. So, let's dive in. To understand a heart attack, we need to know a little bit about how the heart works. The heart is a muscular organ that pumps blood to the rest of the body. It has 4 chambers, the left and right atria and the left and right ventricles. The right atrium receives blood from the body and pumps it to the right ventricle, which then pumps it to the lungs for oxygenation. The left atrium receives oxygenated blood from the lungs and pumps it to the left ventricle, which then pumps it to the rest of the body. Now, during a heart attack, one of the arteries that supplies blood to the heart muscle becomes blocked. This blockage can be caused by a buildup of plaque in the artery or a blood clot. When the artery is blocked, the heart muscle can't get the oxygen and nutrients it needs to function properly. This can cause damage to the heart muscle and lead to a heart attack. So, what are the symptoms of a heart attack? The most common symptoms are chest pain or discomfort, pain or discomfort in the arms, back, neck, jaw, or stomach, shortness of breath, sweating, nausea or vomiting. If you or someone you know is experiencing these symptoms, it's important to call for emergency medical help right away. Now, let's talk about some of the risk factors for heart attacks. These include high blood pressure, high cholesterol, smoking, diabetes, obesity, family history of heart disease, age. The risk of heart attacks increases with age. The good news is that there are things you can do to reduce your risk of a heart attack. These include eating a healthy diet, getting regular exercise, quitting smoking, managing stress, controlling high blood pressure and cholesterol levels, taking medication as prescribed by your doctor. If you do have a heart attack, the treatment will depend on the severity of the blockage and the extent of the damage to the heart muscle. Treatment options may include medications to help dissolve blood clots and or reduce the workload on the heart, angioplasty or stenting to open the blocked artery, coronary artery bypass surgery to reroute blood around the blocked artery. So, to sum up, a heart attack is a serious medical emergency that occurs when one of the arteries that supplies blood to the heart muscle becomes blocked. Symptoms include chest pain or discomfort in the arms, back, neck, jaw, or stomach, shortness of breath, sweating, and nausea or vomiting. If you or someone you know is experiencing these symptoms, call for emergency medical help right away. And remember, there are things you can do to reduce your risk of a heart attack, such as eating a healthy diet, getting regular exercise, quitting smoking, managing stress, and controlling high blood pressure and cholesterol levels. It's important to take care of your heart health and take action to prevent heart disease. Let's talk about some common misconceptions about heart attacks. One of the biggest misconceptions is that only older people or men are at risk for heart attacks. However, heart disease can affect anyone, regardless of age or gender. Women, in particular, may experience different symptoms than men, such as nausea, fatigue, and back or jaw pain. Another misconception is that heart attacks always come on suddenly and are accompanied by severe chest pain. While this can be true for some people, others may experience more subtle symptoms or may not even realize they're having a heart attack. That's why it's important to pay attention to your body and know the warning signs of a heart attack. If you're experiencing any of the symptoms we discussed earlier, don't hesitate to call for emergency medical help. Finally, let's talk about some steps you can take to support someone who's had a heart attack. First and foremost, be supportive and understanding. A heart attack can be a traumatic experience, and it's important to listen and offer comfort to your loved one. Encourage your loved one to follow their doctor's orders and take any medications as prescribed. Offer to help with everyday tasks, such as cooking, cleaning, or running errands, so they can focus on their recovery. And don't forget to take care of yourself, too. Caring for a loved one who's had a heart attack can be stressful and overwhelming. Make sure to take breaks when you need them, and seek support from friends, family, or a professional counselor if needed. In conclusion, a heart attack is a serious medical emergency that requires immediate medical attention. Knowing the symptoms and risk factors can help you take steps to prevent heart disease and potentially save a life. And if you or someone you know has had a heart attack, remember that there is hope for recovery and a healthy future. Thanks for watching. If you found this video helpful, please give it a thumbs up and share it with your friends and family. And don't forget to subscribe to my channel for more health and wellness content. See you next time.